Greetings from BCMS and welcome to our mini webinar, Medicare Mandatory Claim Submission, clarifying the requirements and the options. Here are a few confusing subjects. Hopefully we will unconfuse you. We will be talking about provider enrollment, opting out of Medicare, participating in Medicare, not participating in Medicare, mandatory claims filing exceptions, and HIPAA patient rights. We have two options before us: to accept Medicare patients and not accept Medicare patients. If you choose not to accept Medicare patients, you obviously don't have to enroll in the program. But under no circumstance may you choose to accept cash in lieu of billing Medicare because you're not enrolled. That is not how the game plays out. Medicare mandates claim filing for covered billable services to beneficiaries. Throughout this presentation, I will be referring to PT. However, please note this does apply also to occupational therapists and speech and language pathologists. So we do have two options. Yes, we have choices. We can choose not to accept Medicare patients or to accept Medicare patients. When we choose not to see Medicare patients, we don't have to enroll. However, there is no opportunity to accept a Medicare patient and allow them to pay cash because you're not enrolled. If the services are covered and medically necessary, Medicare mandates that we file claims for all of these services provided to Medicare patients billing Part B. So let's be clear. All therapists in private practice must individually enroll in Medicare and obtain a PTAN, that is, Provider Transaction Access Number, or Medicare number, if they are to provide covered services to Medicare patients. Therapists in rehab agencies, CORFs, Part B SNFs, Part B home health agencies, and outpatient hospital PT departments do not have individual enrollment requirements, but rather provide covered services under the facility's umbrella and provider number. Opting out of Medicare is not the same as not participating in Medicare, and for the life of me, I cannot understand why CMS would choose two terms that typically would seem to be interchangeable. However, they are not. Opting out is very different from not participating. The opting out provision allows physicians and certain practitioners to enter into a private contract with the Medicare beneficiary and to use their own usual and customary fee schedule as they wish. The patient is billed directly for the services rendered. No payments may be made to beneficiaries, i.e. the patient submitting their own claim, when they are treated by a physician or practitioner who has opted out of the program. So these contractual relationships with Medicare have a couple of requirements that must be met for opting out to be valid. The first and most notable is that the physician or the practitioner agrees not to submit any Medicare claims. And you say, "Hark! That's what I want to do." Well, unfortunately, we don't fit into the physicians and our practitioners that are recognized as eligible for opting out. In this situation, the physician and our practitioner agree not to submit any Medicare claims, as I mentioned, nor receive any payment for Medicare for the items or services provided to these beneficiaries for at least 2 years. There are a number of other criteria that fall into the opting out provision, but we will not go into those in this particular webinar. This is worth repeating. PTs, OTs, and speech and language pathologists may not opt out of Medicare. This is in the regulation. It does state who can and who can't, and it also states clearly, as I mentioned, that chiropractors, PTs, OT, and speech and language pathologists in private practice may not opt out of the program. Once a therapist is enrolled in Medicare, they have two other choices. They may choose to participate in Medicare or not to participate in Medicare. I know that sounds contradictory, but that is the terminology that we do live with. So therapists and other suppliers who fit under the Part B billers can choose to participate. That is, they choose to accept the Medicare allowable fee schedule and not to bill a patient any more than their co-share and or deductible. The exception for this is PTs and OTs and speech and language pathology and rehab agencies and CORFs. They have no choice about participation. It is mandatory. So if you have chosen to participate, you will do so by signing a participation agreement, that is the CMS 460 form. On that form, you are agreeing to accept Medicare's allowable charges as payment in full. That means you are accepting assignment. There's no balance billing on any Medicare claims. Now, something to make note of is that if you, in your practice, do not accept 100% of every single payer classification patients that you have, you certainly may apply that to Medicare as well. So Medicare is not saying that every single Medicare patient must be treated in your facility. What are the advantages of participating in the Medicare program? Well, the first one, and this is a biggie, is that you get 5% higher fees than a non-participating supplier. And you also receive payment directly from Medicare. You'll see why that's important in a few minutes. You are listed in directories that are provided to the beneficiaries, and you also have various help mechanisms that are provided by Medicare that non-participating providers would not have access to. Let's review the high points of electing to participate. First, if you do choose to participate, it is accomplished by completing the CMS 460 form or the PAYCOS equivalent if you're filing electronically. The participating therapist or facility will be paid directly by Medicare at Medicare's allowable fee schedule. There will be no balance billing, and the therapist can only collect the deductible or the balance of it, and the 20% co-insurance from the beneficiary. So when you choose to participate, you complete a form. So how do you choose not to participate? If the therapist elects not to participate, that means they do not want to accept the fee schedule as the payment in full, he or she may accomplish this by 1. not submitting the 460 at enrollment. So the initial enrollment, if you do not complete that form, there will be a presumption by Medicare that you do not want to participate. If, however, you decide after being enrolled and after completing the 460 that you do not want to participate, you may terminate that previous affirmative election. Non-participation. Again, what you are saying is you are not willing to accept the Medicare fee schedule at its allowable rate. Everyone's saying, well, that's wonderful. That's what I want to do. I mean, I don't want to be committed to Medicare's allowable fee schedule when in many times it doesn't accommodate the cost for the services delivered. Well, it looks good on the surface. It can be a positive, but let's talk about the things that you have to do. First of all, regardless of whether you participate or do not participate, you must comply with Medicare's mandatory claim submission provision. Now, in the non-participation arena, the therapist can increase the patient's responsibility by 15%. That is called the limiting amount. So that is 115% of the total normally allowable fee schedule. Now this is where it gets a bit questionable. Medicare will pay the patient 75% of the allowable fee schedule versus 80%. Did you catch the underlying information? Medicare pays the patient, not the provider. That leaves the therapist to collect the entire amount billed from the patient. In some situations that is easily managed, and in others you become a collection agency. As if we didn't have enough choices already, let's throw two more choices into the basket. Non-participating or non-par suppliers have the option to accept assignment or not to accept assignment on a case-by-case basis. So if this non-participating supplier, accepts assignment, Medicare will pay them directly, so we've taken away one of the negatives. But the ability to use the limiting charge, that additional 15% over the allowable, is wiped out. There's no balance billing, and the therapist may only collect the 20% co-insurance from the patient plus any applicable deductible. But on the other hand, if they choose not to accept assignment, the non-par physician or therapist may charge up only to the limiting amount and is responsible for collecting the balance directly from the patient. What are the advantages of being a non-participating provider? Well, basically, you do have the potential to have higher revenue than your participating providers. But this can really only happen, and when you get down and do the math, you will have to collect the full limiting charge on 35% or more of the Medicare visits you file. This table has come from an AMA publication in which they are illustrating the advantages and disadvantages of accepting or not accepting assignment. And for the sake of this particular illustration, they used $100 Medicare allowable charges. So when you look at the payment arrangement, the first is the participating supplier. They always accept assignment. So the entire Medicare allowable fee of $100 is what they will be paid, providing everything else is correct and allowable. The amount from Medicare would be 80% of that $100 or $80, and it is paid directly to the supplier. The payment amount from the patient is 20% of the 100, so $20, and it is paid by the patient either at the time of service or upon issuing an invoice. Now, when we talk about non-par, remember they have options, an option to accept assignment. So in the first situation, this is a supplier who is going to accept an assignment on this particular patient. You still start with the 95% of the Medicare fee schedule because they are not participating. The amount from Medicare would be $76 or 80% of the $95. But in this case, because they're accepting assignments, they will be paid directly by Medicare. The amount the patient pays is 20% of the $95 or $19, and again, it's collected at the time of service or upon invoicing. So when we have the non-participating supplier who does not accept assignment, they do have the prerogative of activating the limiting charge of the 115% of the 95% of the Medicare fee schedule. And effectively, that's 109.25% or $109.25. The amount received from Medicare is $0. So all of the payment is going to come from the patient who has been paid by Medicare. So Medicare paid the patient $76, again 80% of $95. The $19 is the 20% of the $95. Again, that is to be collected from the patient. And the balance is $14.25 that can be billed to the patient and are collected at the time of service. So if you have good collection at the time of service, this might be the way for you to again increase your payments from Medicare. But if you have to invest staff time on collecting and those types of things, this might not be the best way for you to go. I feel it's essential to reiterate this. There is mandatory claim filing regardless of whether you are a participating or non-participating supplier. The Social Security Act, Section 1848 G4, requires that claims be submitted for all Medicare patients for covered services rendered on or after September 1st, 1990. If you feel like you're being monitored, if you feel like someone is looking at what you do or don't do, please know that that is probably accurate. CMS is definitely monitoring our behavior as suppliers who submit or don't submit claims. There are violations that could be subject to civil monetary penalties of up to $2,000 for each violation. So whether it is because you are not filing claims for Medicare covered services, but rather accepting cash, each one of those situations, dates of service, billings, could be subject to this $2,000 per violation. If it relates to your participating or non-participating status, for instance, if a participating supplier balance bills a patient, that is something that will show up on the radar. If a non-participating provider exceeds the limiting amount, you can better believe that is being monitored. You can also be excluded from the federal program, and that has long-term and horrible consequences. And if indeed you were excluded, they allowed you back into the program, you will never ever get paid the full amount of Medicare allowable. They will reduce the particular payment to you by 10% if, again, they allow you back into the program. And a note that you need to be aware of: beneficiaries may not be charged for preparing or filing a Medicare claim. There are some exceptions to mandatory claim filing, and these are the ones that are listed in federal regulations. If this involves used durable medical equipment from a private source, there is no need to file a claim. If Medicare is a secondary payer, information is not provided by the patient, you do not have to file a Medicare claim in that situation. Any services provided in foreign land, those also do not require claim submission. Opted out physician or non-physician practitioners, and remember that does not apply to us, those individuals are prohibited from filing claims or obtaining payment from Medicare. That also includes the beneficiary. Free services, obviously, there is no need to file a claim. The indirect payment procedure really doesn't involve us, wouldn't apply, because it would be for individuals or entities that would not ordinarily be allowed to enroll in Part B Medicare as a supplier. Non-covered services, so if we were looking at something like wellness, injury prevention, those types of things that are not covered services by Medicare do not require the billing or filing of a claim. And then we have HIPAA patient rights, and this particular exception deserves its own slide. In 2003, HIPAA's privacy laws went into effect, and part of those regulations included patient rights. One of the rights the patient had at the time was to request a restriction on the disclosure of certain protected health information. And in 2013, as a result of high-tech and the omnibus rule, that particular patient right was expanded. Now, or since 2013, a covered entity, that's us, providers, must agree to a patient's request to restrict disclosure of protected health information about them to a health plan, if the disclosure is for the purpose of carrying out payment or healthcare operations. So the protected health information that the patient is asking to be non-disclosed, or a restriction on disclosure, must result in payment in full by the patient. If a provider declines, that would be a violation of the patient's rights. If a provider induces a patient to pay cash for services rendered to avoid enrolling in Medicare, that would not be in concert with the intent, and I would say, in my opinion, you will certainly be on someone's radar. Here are a few steps that you need to consider when you are exercising this provision of patient rights. You should have a compliant policy and procedure in place. The patient should be independent in their request for no payer involvement, i.e., it is not set as a condition of treatment and it is not advertised as a cash-only service. A policy and request, the policy and request should be reviewed by your HIPAA officer. The patient should be provided with a payer waiver form, so there are waiver forms that we have developed. You can certainly develop your own, but this will give the patient adequate explanation of their right under HIPAA. And when the treatment is delivered or the items are provided, this would be at cash paid in full. So you say, who's going to know if I decide to have a cash-based practice and not file Medicare claims? Well, if you don't think beneficiaries are whistleblowers, then you need to re-examine what is really happening out there. If a beneficiary receives covered services from a provider or a supplier, and they refuse to file a claim or tell upfront that this is a cash-based practice, then Medicare is telling the beneficiary, and they get lots and lots of information from Medicare, that they should notify their contractor, so your MAC, in writing that the provider refused to submit the claim. And then they have the right to submit the CMS 1490S with all supporting documentation and be paid directly for that service. That does not mean that that's acceptable. It means that they are trying to give the patient the right to recoup their funds. So in the situation that I just described in the previous slide, if the beneficiary self-submits a claim, the contractor will inform the beneficiary by letter that the provider or supplier is required by law to submit a claim on behalf of them for a service that would otherwise be payable. So they are getting this in print from CMS. And they state also in this letter that in order to submit a claim, the provider or supplier must enroll in the Medicare program. So to hit the high points, therapists do not have to enroll in Medicare, but they will not be allowed to treat Medicare patients for covered services if they are not enrolled. Therapists in private practices may not opt out of Medicare and therefore cannot accept cash from a Medicare beneficiary for covered services. Therapists in private practice have a choice when they enroll as a Part B supplier. They may accept assignment or decline to accept assignment. And finally, HIPAA's patient rights permit a patient to restrict payment information from Medicare, and in that situation, the therapist may collect cash from the patient as long as the patient pays for the covered services in full. So this wraps up our mini webinar, and I sincerely hope it has provided you with information to help you make the right choice, to help you understand what your prerogatives are and what the restrictions are as it relates to Medicare mandatory claim submission and your enrollment options.